Thank you for joining us for the HPL seminar. Today it is my pleasure to introduce our speaker, Dr. Kathryn Dane. First of all, I want to acknowledge she stepped in at short notice and had a cancellation, so she's here presenting for that. So thank you again for that. Dr. Kathryn Dane is a postdoctoral associate here at the Sport Injury Prevention Research Center at the University of Calgary, where she works under the supervision of Dr. Carolyn Emery. She completed both her BSc and PhD in physiotherapy at Trinity College Dublin in Ireland, finishing her PhD in 2024. Her research was focused on safety and optimal tackle outcomes in women's rugby under the guidance of Dr. Fiona Wilson and Dr. Kieran Sims. In addition to her academic achievements, Kathryn brings a wealth of lived experience in sport. She is a former international rugby player for Ireland women's rugby, and also represented Northern Ireland in the under 15, U17, and U19 levels in soccer. And since moving to Calgary, she's been adjusting to the winters, does not like it, as most people, but has been fully embracing the summers, spending her time hiking, rafting, and exploring local breweries. Today, she will be presenting her work on co-designing a return to contact toolkit following concussion in girls rugby. So please join me in welcoming Dr. Kathryn Dane. Perfect, thank you.
Do I have to use the?
Just that's fine.
Okay, perfect. Okay, thank you for the introduction. Good afternoon, everyone. As Ashna kindly said, today I'm going to be talking about co-designing a return to contact toolkit following concussion in girls rugby. I wanted to start by acknowledging all the wonderful collaborators and partners that have been supporting me in this research project so far. It really is an international transdisciplinary team from all corners and all continents. My partners also include Rugby Alberta, School Sport Alberta, Rugby Canada, and Rugby Americas North. So it's I play team sports and I like to include big teams in my research endeavors as well. Because it's a co-design project, I thought it was important to acknowledge my positionality coming into the research. So as Ashton has mentioned, I'm a physiotherapist, former international rugby player. A couple of injuries now meant that I've hung up my rugby boots, but I'm a coach and I'm a postdoctoral associate here at the Sports Injury Prevention Research Centre, supervised by Carolyn. So I did all my work in Trinity College in Dublin in women's rugby, and I hope to come to the University of Calgary to expand that work to adolescent girls rugby here. And all of my partnerships previously were with the Irish Rugby Football Union, and I've now moved to the dark side and I'm working with Rugby Canada. But it's okay. Rugby Canada women's rugby really demonstrated their prowess in the international stage during the World Cup there, so I'm happy enough to help support. I wanted to briefly touch on some of the previous PhD work that has got me to this point. I conducted a number of reviews with a number of colleagues, really to try and understand the depth and breadth of research that concerns tackle safety in girls and women's rugby. Should be looking at the physical and technical demands and preparatory strategies in female field collision sports. I've also worked on a number of special editions on women's rugby, especially with regards to return to rugby postpartum, as well as the kind of gender-specific considerations for contact training and coaching in women's rugby. I also had a more recent review on publicly available tackle safety guidance among national and international rugby organisations, but I'll touch on that one a little bit later. I also had the pleasure of conducting qualitative research with 21 women's rugby union players from Europe, North America, and Africa during my PhD, and I asked them about their experiences of tackling from a contact skill perspective, but also from tackle injury perspective as well. And that took me down various avenues, and for any of the qualitative researchers in the room can probably relate to the amount of work that goes into those qualitative pieces. And from that, I bounced into doing a global survey to try and understand the knowledge, attitudes, and practices of women's rugby coaches in relation to tackle training. From that, I went on to analyse 1,500 tackle events from the 2023 Women's Six Nations Championship to really get a better understanding of, well, how do women tackle? Do they adopt the recommended tackle techniques that World Rugby and other organisations prescribe, as well as trying to get a deeper understanding of direct head-to-head contacts in the game as well. So those kind of experiences really set me up nicely for starting my postdoc here, but there was one key piece missing, and that was the epidemiology component of my training, which we know Carolyn is well versed in. But I was also one PhD student in a very tiny lab back home in Dublin, and now I've been really fortunate to be surrounded by a large team of honour students, masters, PhDs, postdocs in the Sport Interprevention Research Centre. So it's been a brand new experience for me. And I also get to bring my international colleagues to wonderful places like Surreal Ridge and other amazing spots in the Rocky Mountains. So it's been a good transition for me. I also earned my first Stampede White Hat, and I get to experience the Shed RD, which I'm sure you've seen that on countless presentations for anything citrusy related. So the rationale behind my co-design project is that girls rugby is rapidly growing globally and in Canada. It's considered one of the fastest growing sports here. But unfortunately, with that comes really high rates of tackle-related concussions, particularly in the high school game. We know from existing men's rugby research that tackle technique is a key modifiable risk factor for concussion injuries. We know that 30% of concussions are recurrent, and that 30% of youth are symptomatic for months, which has significant downstream public health impacts, particularly when you think about the physical and mental impacts, as well as the longer term implications on sport participation and physical activity in later life. So there's some key opportunities for secondary prevention of recurrent concussions in this population. But a recent review that I conducted just last year on that publicly available tackle safety guidance and the concussion guidance is that there's clear gaps in terms of research and practice for return sport for girls rugby. So in the absence of that evidence, I believe that a co-design approach with community partners is the key first step towards this. When we look at the existing guidance, obviously the Amsterdam Consensus Guidance from 2023, the good work of Carolyn, Kathryn Schneider, John Patricios, and many others that are involved in this institution, that kind of paved the way in terms of World Rugby's guidance. They both adopt that kind of 6-step process, whereby after medical clearance, players are to return to non-contact training drills, which talks about passing drills, multiplayer training. They can integrate into the team environment again. Then full contact practice, which means participating in normal training activities, and then that return to sport, normal gameplay. But you might notice that there's no explicit instruction on what the return to contact activity progressions look like, or what some of these key competencies or functional skills that they talk about for the coaching staff. So the guidance is a little bit limited. So the overall aim of my co-design process was to co-design and evaluate a return to contact program to reduce tackle-related concussions in Canadian girls rugby. I adopted the knowledge to action framework to help guide my approach. So this is a community-based participatory action research approach, and I split it up into 3 key phases. Firstly, informing the co-creation, followed by phase 2, which involves the co-design and implementation of the tackle preparation intervention, and then phase 3, which involves the evaluation of the co-created tackle intervention. That first phase will involve multi-method exploration, and I'll go into a little bit more detail of what that looked like exactly, but it involved a combination of injury surveillance, knowledge user surveys, interviews, practice, video analysis, as well as instrumented mouthguard, data collection to understand head acceleration events across practices and games as well. So I'm going to talk you through some of the stages that I've been on so far. So that first step of knowledge synthesis was really to identify the existing evidence and practice gaps. Second step was knowledge inquiry, so generating some primary evidence to fill some of those gaps with what we have at our disposal here in Citrusy. Third step was knowledge adaptation to understand the local context, make sure we have an idea of the implementation context, any barriers and facilitators to knowledge use that we do generate through this process. And then the last step, or that kind of final step that I'm going to talk about today, is the co-design, which involves really prototyping, tailoring, and piloting and refining this return to contact toolkit. So in that first step of knowledge synthesis, I conducted an evidence review of the publicly available tackle safety guidance amongst 18 national and international rugby organisations. And I was quite surprised to find that only one rugby union provided guidance on return to contact following concussion. I know I'm biased, but it was the Irish Rugby Union, so it's kind of bad to see that. But even within that guidance, it didn't have a key kind of progression of contact activities for each stage of that process. So there is still some practice gaps out there. From reviewing the original literature on injury surveillance, we know that in professional English men's rugby union that players have 60% greater risk of time loss injury after concussion, both musculoskeletal injuries and concussion injuries. And there's some really exciting work coming from a number of PhD students in the Sports Injury Prevention Research Centre, Eric Gibson and Stacey Sick, in regards to understanding the rates of recurrent concussions in collision sport athletes of adolescent, high school and club grade level. So that's really exciting, and I'm working very closely with them to get that information out there. I've also been consulting some of the biomechanics work that's out there, particularly regarding head kinematics in rugby practice and games from researchers at the University of Bath, Calgary researchers and some research colleagues in tackle football in Wake Forest University. I'll touch on those in more detail in the coming slides. So for example, from our colleagues in Wake Forest, they used instrumental mouth guards to understand the head kinematics in tackle football and youth tackle football. And from that information, they were able to inform, I think it's USA tackle football's levels of contact guidance. So moving from no player-to-player contact, air kind of contact, bags, control the ground, thud, lie. We use different terminology in rugby. We call it controlled contact and full contact and set piece contact. But it's good to see that biomechanics research was then used to inform some of their tackle coaching materials for USA football. I know from my colleagues in South Africa, Sharif Hendricks, who might have presented at the HBL seminar a few years ago, that we do have an idea about tackle coaching in terms of optimal challenge progression, moving from technique proficiency in that earlier stages with highly structured, highly controlled training environments, working towards building skill capacity and adaptability with a little bit less predictability, higher representation in terms of the training context, and more unstructured drills. I'm moving along the spectrum from that prescriptive coaching style towards descriptive and guided discovery. So for anybody that's interested in coaching science, that is kind of one of the key pieces of information that we use in rugby for informing skill progressions, whether that is kicking, passing, tackling. And information from our colleagues in the University of Bath has found that the incidences of head acceleration events were halved when repetition-based rugby training drills used pads compared with no pads. And we know from the work of our summer student last summer, when looking at the rates of head acceleration events in adolescent girls rugby, that the highest magnitude of head acceleration events were found from tackle events or from the tackler, but actually most suspected concussions happened to the ball carrier in those events. So for me, it meant, okay, well, if we do have some form of return to contact guidance, it has to also include the ball carrier within that as well. When it comes to rucking, like the attacking ruck and defensive rucks, it's got lower rates of and lower magnitudes of head acceleration events, but it's still something that we have to consider in our contact guidance. In terms of knowledge inquiry and generating some primary evidence ourselves, I created a return to contact survey that has been used by 237 players, 23 coaches and 31 healthcare professionals, and it aimed to evaluate the knowledge, attitudes and practices shaping return to contact behaviours following concussion. I also conducted a number of interviews with coaches, players and healthcare professionals. Last season, we also video recorded the practice sessions that were in high school girls rugby and club rugby to characterise the type, structure, duration and contact level and adoption of World Rugby recommended tackle training components. And we also included instrumented mouth guards with both age grade girls rugby, high school rugby and varsity practices to evaluate the intensity and content of tackle training activities. And a number of these manuscripts are in the process of peer review and write-up. So when we had a look at contact exposure in regular practices, we asked coaches to tell us, okay, what day of the week are you going to have your most contact heavy practice? We'll come out and film it. As part of the shred program, we have a number of team designates that go out and check attendance at practice sections as well as their exposure to contact. So it was easy enough for us to get down and film those practices. So in the end, across Alberta and Quebec schools and clubs, we had 251 routine practice sessions. And what we found was that controlled contact activities were observed for 77% of these sessions. I want to mention as well that they told us that this would be the most contact intensive session of their week. And they spent median of 11 minutes of their time in controlled contact in those sessions. In terms of full contact activities, only 9.2% of those 251 sessions actually included any form of full contact. And when I say full contact, that's the stuff at the far end of the spectrum that mimics tackling that you might experience in games. So it's important to do that. But the median time spent was 0 minutes in that activity. But considering only the sessions that did include full contact, that median kind of worked out at about 11 minutes per session. So they're not getting exposed to very much contact in practices in the first place. And in terms of adapting that knowledge to make sure that it fits the implementation context, we took a closer look at the return to contact survey and return to contact interviews. And from the quality of findings, we find that return to contact is characterized and shaped by a number of these key categories. So some misunderstandings of concussion, that it's invisible and inevitable, yet feared for its long-term consequences, that it's influenced by multi-dimensional readiness factors, including psychological readiness, medical readiness, physical readiness, and technical readiness. But it was interesting that a number of the players and coaches within that, whilst there was these various readiness components, they were still perceived to be this degree of uncertainty or a leap of faith when it came to reintegrating girls back to contact training. Another interesting finding was that kind of responsibility and decision making for return to contact. We find that was a shared or perceived to be shared but uneven accountability across players, coaches, and healthcare professionals. There was a reliance on athlete self-advocacy, compensated for gaps in healthcare presence rather than genuine autonomy. And there are a number of key structural and cultural influences whereby coaches were really acting as de facto gatekeepers to return to contact amid the volunteer-driven systems that exist for girls rugby, as well as the enduring sports ethic norms and fragmented healthcare professional access. So you can see, for example, in this quote here, whilst coaches were kind of deemed as those most responsible for reintegrating girls back to contact, the level of coaching and refereeing is not where it needs to be in this country. It's not good enough, and this is a coach saying that. And again, to relate to some of the findings about the misunderstandings of concussion, we had a player here talking about let's not be throwing around the C word until we know for sure. So there's just lots of different misconceptions still about concussion, even though a number of these players, coaches, healthcare professionals have been exposed to this information for a number of years. When we looked at the survey, mixed methods finding, in terms of the domain of familiarity with the return to sport steps, we found that there was moderate to high familiarity with the return to sport steps among coaches and healthcare professionals, which indicates a general awareness of concussion management processes. However, players' exposure to structured guidance was inconsistent, with just over half of the previously concussed players actually being walked through the return to sport steps. So procedural knowledge of key components of return to sport guidance was inconsistent, as both coaches and healthcare professionals most frequently reported minimum return to sport timeframes shorter than the World Rugby recommended timeframes of 21 days. See, a number of them have reported 7 days and 14 days as kind of the recommended guidance, but it actually is those 21 days. And when we compared that to the quality of findings and expanded upon that, it was deemed that this familiarity with concussion processes may reflect general awareness and a declarative knowledge rather than a detailed procedural knowledge. Participants highlighted the need for clearer guidance and ongoing education to support consistent implementation of return to sport protocols across coaches and athletes. And when we look at the top three barriers to return to sport reported across players, coaches, and healthcare professionals, lack of access to healthcare services, as well as pressure to return too early, were deemed kind of the most important across those participant groups. And qualitative findings really indicated that these barriers were embedded within broader sporting environments where competitive demands, societal expectations, and structural constraints, such as the shorter playing seasons in Alberta and the restricted training resources, can help shape how athletes navigate these return to contact decisions. And then what we're doing at the moment is really undergoing the co-design process. And we started off by really establishing team roles and expectations in that process. And to give some context, we have an overlapping research steering group of international researchers from many disciplines, as well as a co-design advisory group of players, coaches, healthcare professionals, as well as representatives from national and provincial sporting organisations in rugby. And part of the establishing team roles and expectations involve capacity building, understanding that they want to be co-authors in the research, what capacity did they have to give towards this? Also terms of reference, what did they expect from us as researchers, but also of each other as part of this co-design advisory team. We also asked them about their preferences for engagement and how they wanted to be communicated with. And then using nominal group techniques, we began brainstorming what were the most important components of a return to contact toolkit for these people in terms of what did the content have to be, what was the delivery format, and some of their implementation recommendations for making sure this sort of toolkit gets used within their context. And we plan on evaluating their engagement with the public engagement evaluation tool. It's a patient and public engagement evaluation survey tool, but this is just public. So here are some examples of the prompts and activities that we've been doing. So there was a number of online tasks and online workshops with the group, because it is a group of co-design members from multiple corners of Canada. So with different time zones and things, we can't do as many in-person meetings, but we used resources like Menti and Padlet to really brainstorm as many ideas as possible. And last Thursday, we were in this room here with the local co-design members to really just brainstorm some more ideas. So this is kind of where the toolkit is at its current iteration. But off the back of that meeting, we're going to have to go back to the drawing board and really change things and make it a lot shorter. But it's been really worthwhile, and I really enjoy getting people here and giving them some pizza and coffee and Timbits. So don't comment on how bad our handwriting is there. So another key component of this return to contact toolkit is making sure that it's theoretically informed and theoretically evidence informed and theoretically driven. So I go back to this optimal challenge progression framework that was proposed by Sheree Hendricks to help describe the key phases of return to contact that our co-design team has come together with. So kind of starting off with that reconnect phase, performing contact activities in more static, very highly controlled conditions, working towards added movement, working towards adding cognitive load, such as decision making, adding controlled contact, so a bit of movement, a bit of speed, a little bit of unpredictability, and then working towards that full contact phase at the top. And these phases and the contact activities have been informed by World Rugby's contact confident resources, as well as their tackle ready and key performance indicators. So trying to stay as close to the existing evidence and the guidance as possible. And this gives you an idea of the breakdown of the activities at various stages. So in that second stage, you have a number of kind of contact preparation activities and very limited contact technique activities, because they're done in static positions, working towards kind of controlled contact and full contact levels there as well. Funny, as part of the co-design meeting we had last Thursday, the idea of making medical clearance as explicit as possible came out. So we have to find a way of whatever we do that for those last three stages of the return to contact process, that we really hammer down that athletes need to be medically cleared before that point, because there's different perceptions of what clearance means. And I think for some people, they think it means return to match, but you have to go through contact and make sure that you're hitting certain contact competencies before you're deemed ready for matches. Another key element was that there had to be these contact activities had to be embedded with education, such as concussion recognition, management, recovery recommendations. They also had to encompass that multidimensional readiness that we talked about earlier, in terms of that psychological readiness, particularly for girls who maybe this is their first time playing a collision sport. So do they feel confident? Are we sure that they're positive about returning to contact? Giving coaches tools to check in, to give the rationale, the why behind these contact activities, and then make sure that they're comfortable to progress. We're also using guidance from the consensus statement, the concussion recognition tool, as well as Parachute Canada's concussion education guidance to help build up this toolkit. But we don't want to make it too big, so we're trying to figure out how we compile it in a way that's still user friendly. So in terms of the next steps, I'm working through all the feedback that I've got from the various co-design members and research steering group members. But in terms of the contact activities and the phases, they're very happy with that, and we're in a position where we can go forward now and start generating photos and videos of those contact activities. We're going to get a graphic designer on board to populate a standalone web page on the Citrusy website. We'll also generate one-pager information sheets for cater to players and their parents, coaches, and healthcare professionals. And then we hope to pilot and evaluate this return to contact toolkit in varsity and girls club rugby this season. So it's an ambitious timeline, but it's been an exciting process, and I'm really proud to be part of it. That's me. Thank you.
The floor is open for questions. Would like to start us off? Great.
Thanks for that.
All right.
How does the incidence of concussion differ between backs and forwards, or different kinds of backs, say inside outside centers versus wingers and fullbacks? Does it differ substantially? It's pretty similar.
In terms of concussion, it's a good question. I don't think we have that information for adolescent girls rugby just yet, but in terms of men's rugby, we probably have that information. I can tell you for head acceleration events, they vary considerably across different position groups. Inside centers take a lot more head acceleration than the outside backs, for example. Scrum halves like myself and tens tend to take less of a load when it comes to the head acceleration events. But that's a good question. I need to brush up on finding that out for you. Thank you.
I ask because I think ultimately probably where this kind of research is going, and based on sort of what I know about Stephen's research and other people's, it's like is rules of tackling and how to appropriately tackle. And I feel like it's in some instances it's really easy to tackle according to rules, right? Like if the forwards are just picking and going, you know exactly where they're gonna be at the exact same time. To some extent, I think that those inside centers and outside centers, it's a little bit more predictable too than it is when you're in an open field and somebody breaks the line of defense and you have to. So that was just a comment.
No, that's a good point. And some of the injury mechanisms are quite different depending on whether it's head to head for those inside centers or head to ground for maybe the outside backs that are getting tackled from behind or tackled into the stands or something. We know from interviewing those girls as part of the return to contact work that a number of them had kind of whiplash mechanisms and head to ground. A lot of them told me that they're still quite fearful of like jersey tackles and those sort of things, and they've got a bit of like fear avoidance about people tackling them incorrectly. And I know that's not really an accepted tackle behavior, but with the level of refereeing and coaching that you get in community rugby, those things happen and it's hard to control for that. But it's something that needs to be considered when we do bring girls back through a return to contact program is, you know, should we think about exposing them to different tackle scenarios and, you know, aerial collisions and things like that too. So
yeah, and along the same lines, I was thinking about the idea of training people on how to tackle and exposing them more to tackling scenarios in practice to better prepare them for the game. And I guess very quick question, or the first part of the question is, has anyone ever done the study where, you know, I don't care if it's an RCT or not, but like where some people, they have more training in how to tackle, and then they're sort of, they're followed for a period of time versus others that weren't, to kind of definitively show that the rates of concussion are lower, because you also are kind of increasing the risk of concussion by doing the training in practice.
Yeah.
And it also seems in my mind like a really hard study to do and get funded and all that kind of stuff. So.
And that links
has
to
it been done?
that links to Stephen's kind of next steps for introduction to contact as well, and understanding if playing experience has any sort of link to concussion rates. I think from his work with Ida Schill back in the day, that experience doesn't seem to have a big influence on tackle competency or injury rates, but I guess we just need a little bit more information about understanding the training effects of that as well. Because what are they getting exposed to in training? We know that they do probably 0 minutes of full contact training in their practice weeks, so they're probably not getting exposed.
Yeah. Okay, I just thought of one more.
Go for it.
And it's very rare that we get a speaker that's a national, rugby player, 23 tests or whatever. First of all, that's really cool. So how much tackling was your team exposed to in training? You talked about it was like the median was 0 for the girls here. What is it like at the international level?
It's a lot higher, and it's a kind of a shorter window because you're training with your club teams and then you're brought in for a camp window. So my training weeks would have looked like a Friday, Saturday, Sunday. And it would gradually ramp up. So you could do your more controlled contact the Friday, Saturday, and then the Sunday would be balls to the wall, full contact, because you didn't want to injure people in the Friday, Saturday sessions, but it would gradually ramp up. And I would say you would accumulate a lot, like close to an hour probably of controlled contact activities and maybe 20 minutes of full contact on that Sunday. But again,
And then the test match would be when? Like if you were.
Oh, it would be like the following Saturday or something.
Okay.
You wouldn't be doing much contact the same week as it would build up. But no, it's a fair point. And the issue is as well that some players get exposed to more contact than others. You talk about positions. So the forwards probably do a little bit more contact in terms of the counts of reps that they do in those practice sessions compared to someone like me who's most likely feeding the ball or anyway, I get a nice clean kit at the end of practice. But I'm kind of unique that I play my rugby with boys from U8 level, like U8, U10, U12, and then they stopped insuring you in the UK for rugby after that point. So that's why I went to play soccer for a bit and then got back to rugby again at U18. But honestly, that co-ed experience of being exposed to tackling with boys really benefited my technique, because I was never going to outpower or outstrength any of those boys, but my technique was really good and kind of stood to me for my international career as well. So I'm a big proponent of co-ed for youth rugby. I know it's not a popular thing, and it's good to have girls only teams too, but I think if the numbers aren't there, let them play with the boys.
Andrew, did you have a question before? Because I saw your hand go up.
No, but maybe a comment like the co-ed. Like they do here play co-ed, but they only play co-ed up to contact. So they don't start big contact at it's U13.
That's right.
And so it will be co-ed up to their U13, and as soon as it's U13, then it's boys and girls stuff.
Yeah.
I think if they did it tackling, they're not in games. The training would be way better.
Nick, you had a question.
I do. Thanks very much for the presentation. I think my first comment is Dr. Edwards knows a lot more than about rugby than I realized. I want to ask you about the knowledge to action framework that you use and the sequencing where you chose to start. And what actually specifically when you chose to do co-design, which is towards the end, and something you said actually that kind of made me think of this. When you did the session in here and you got people to write stuff on the board, and it pushed you go back to the drawing board a little bit. So you can start co-design with engaging in co-creation from with participants at the very beginning and then driving the process throughout. And I wasn't sure, it seemed like you did that more towards the end, am I right? Like, it looks like you did the reviews first and then?
It was kind of the timing of the reviews was I was finishing my PhD in Trinity, so it was kind of with the Trinity group that I'd done that review, and I knew that I was building into this project, but in terms of the surveys and interview guides, that was done with the co-design team as well. I didn't really, they helped me inform what line of questioning would happen, and also their comments about, well, they're not getting exposed to contact and practices, informed us going about filming those practices and actually coding them. So they were involved, but just not with the reviews and things. Only when we got here.
My question then, what are the pros and cons of getting the participants, the users, involved earlier versus later?
I think for us, it's been really beneficial getting them to inform the line of questioning on the surveys, the interview guides. Problem is, with any co-design, it's kind of messy, and I made the mistake of having too big a group, I think, compared to previous projects. There's a few too many people with different capacities and time commitments, so that was a challenge. But I do agree with your point of engaging them as early as possible.
But that could lead you up into a lot of directions you don't want to go in because they don't know anything about research.
Yes.
Sarah.
Yeah. For example, in the very first co-design meeting, one of the players who plays representative rugby and is playing her rugby in the UK has been exposed to supplements and concussion and said, oh, well, within this toolkit, there has to be something about supplements and concussion. And I was thinking, oh, I don't know if we can go down that rabbit hole. So you have to manage a lot of expectations and different points. Like you said, it's tricky balance because they come from so many diverse backgrounds.
Great, thank you.
And
So on that return to contact thing, do you think there needs to be a division kind of between forwards and backs? Kind of a bit more of a positional return to play?
Yeah, I think it's something that has to be factored. We've gone about the approach of having quite global contact activities. But within that, you can absolutely certainly layer position specific component to that. And it's something that we're going to factor into. We're going to have competencies at each of those levels. But within that, a question of have they been tested in different position specific scenarios. So your pick and goes, your the aerial kind of high ball catch and stuff.
Like your type 5.
Yeah.
The demands on that for a contact. Well, they've really changed the rules of scrumming now. And there's not really a big getting, but there's still that really high physical exertion.
Yeah, the isometric kind of.
That isometric
yeah.
Fight for position.
Mm.
I don't think it really replicate too well outside of actually doing spring.
Yeah. We purposely, for the purpose of this resource, focused on tackle, carry, ruck, because it, from the epidemiology research and biomechanics, it suggests that they're the events that get the highest magnitudes and frequency of accelerations and concussions than the scrums, but it's certainly something to reintroduce those type 5 to when they do come back to contact. But yeah, we also have to be careful not to throw the kitchen sink at it as well.
Other questions for Kathryn? Well, if there are none, then let's thank you for your talk.